Hello and welcome to our Spotlight on Podcasts here at the ISNTD Festival. If you've been with us for over the last 2 days, welcome back. Or if you're just joining us for this podcast session, well, welcome to the ISNTD Festival. As you may know, this is the annual event by the International Society for Neglected Tropical Diseases, bringing all things creative together with the fields of infectious and tropical diseases. So we've been running for 8 years now. We have never had the pleasure and, in fact, the honor of running a spotlight on podcasts. Over the years since we've started in 2017, podcasts have grown in number, in popularity, but also in importance and sometimes cult following. So it's really a pleasure to welcome today our speakers who are going to be shining a bit more of a light onto this very interesting communication format and form. Lots of different kinds of podcasts, but all centered around this topic that brings us together, which is infectious diseases. I would like to start by saying that women too make amazing podcasts, and it's not that they weren't invited to this panel. It was just quite simply that the timing or other reasons it didn't work out, but they are out there. This podcast will kill you, Febrile, Vax Talk, lots and lots of amazing podcasts run by women, female hosts. So that was just really coincidental. So I just thought I would mention that before we really get started. So a very warm welcome to our speakers today. On screen, I'm just going to go clockwise around my screen. It's my pleasure to welcome Callum Mutch and Jame McCrae. Hi, Callum and Jame.
Hello, hello.
Hello. You run the one and only IOTS podcast. I really need to say podcast correctly for this session. Infectious Disease Insight of two specialists. You're based here in the UK. We're also joined by Garry Aslanyan. Welcome, Garry. You're representing the WHO TDR program with the podcast called Global Health Matters. And it's also my pleasure to welcome you, Okete. Hello.
Hi, Megan.
Hi. And you're the founder and the host of Immunology in Africa podcast. And it's my great honor to also share that you're one of our ISNTD science communication interns. So really pleased to have you on screen with us today. So over the next 90 minutes or so, we would love to hear more about your podcasts, how they came about, what they focus on, but also what are your intended aims and audience, and perhaps help anyone who is a scientist or who's interested in this format to understand what might be some benefits to communicating about their research or their science, how they can get involved, etc. So we're very grateful for your time. Without any further delay, I'm going to hand over to our first speakers, and that would be Wealth. Over to you. We'd love to hear more about your Immunology podcast, Immunology in Africa podcast, where you really highlight and put the focus on young researchers in this field. Well, over to you.
Okay, great. Thank you so much. I will start by saying a very big thank you to ISNTD for the opportunity to come here and talk about my work at the Immunology in Africa podcast. Like Megan mentioned, I'm currently an intern on the ISNTD, and it has been a pleasure to be working with such an amazing organization. I am Wealth Okete. I am the founder and host of the Immunology in Africa podcast, short form Immuno Africa. And I'm here this morning to just take you through our journey and share highlights of some of the contributions we are making to further and strengthen science communication and education in Africa. So this is my outline, and then I will just comment. So a bit of background. I am a trained biochemist. I studied biochemistry here in Nigeria, and during my undergraduate days, I took a keen interest in immunology, with the connection with infectious diseases and vaccines and related topics. So that was how the interest in doing immunology research came about, and that interest, I sustained it beyond my undergraduate days, and even after undergraduate, I was committed to still pushing that interest in research. But something interesting happened after I graduated from university. I Prior to that time, I'd never heard of science communication, so I learned about science communication and felt it was really an interesting field to explore. And long story cut short, in 2022, I launched the Immunology in Africa podcast that kind of merged my interest in science communication immunology, and of course, my commitment to strengthening research and education in the continent of Africa. So what's the focus of the podcast? And like I've highlighted earlier on, so it's all about science communication and education. So, and targeting immunology and related research. And then of course, we host African scientists and try to cover stories around stories about the continent. So that's like the core of what the podcast is all about. And our target audience are scientists and researchers, most of whom we bring on the podcast to talk about their work, their contributions, their achievements, and the challenges they are facing, as well as share their perspectives about science and research in the continent. And we also have an audience for emerging and aspiring scientists who are individuals that can learn from the work of some of the scientists that we host on the podcast, and also be inspired by their work, or maybe even find role models and mentors from among the guests that we bring on the podcast. And of course, members of the public who are interested in science, and then key stakeholders, because just to highlight that concerning key stakeholders, some of the conversations on the podcast also has to do with how we can strengthen research, what is being done well, what isn't being done well. So stakeholders can also get insight on how to improve on their work, or how to improve on their contributions towards strengthening African local capacity from our podcast. So why did the podcast start? So why do we have the Immunology in Africa podcast? So like I mentioned earlier on, the podcast is an offshoot of my shared interest in immunology and science communication. So I started the podcast to explore that interest and to express myself. So that's like one major reason why the podcast started. And then there's also the case of COVID-19. I like to think that COVID set the stage or background for several things to spring up. And although the podcast did not start at the heat of the pandemic, but the podcast the pandemic provided a background for the podcast to start, because I believe most of us here can attest to the fact that the relevance of immunology, the relevance of vaccinology was really amplified by the pandemic. We know all that happened with researchers trying to understand the new virus, trying to develop vaccines at breakneck speed, and so many things that happened with that pandemic. So that also provided a background for me to do this. And there was also the place of representation. And while I was launching the podcast, I also realized there wasn't any podcast of this any platform of this sort that targeted African immunology specifically. There are several science communication podcasts in Africa, but considering the kind of contribution that the field of immunology makes in the continent and globally, I think it was important to have a niche podcast for that field. And of course, there's also the aspect of amplifying and celebrating the works of African immunology, simplifying immunology, which a lot of persons like to believe is a pretty complicated field. And of course, to democratize access to knowledge, ensure that everyone, or as many persons as we can, are able to access and understand what immunology is all about. And celebrating African immunology and African immunology scientists, inspiring next generation scientists. And there's also the need to inform and educate the public, combat misinformation and myths. And we know vaccine misinformation, but they're not just vaccines. There are several infectious diseases that people do not understand. And so they want to associate it with maybe a curse or a cultural phenomena. So some of all these are conversations we have on the podcast to just enlighten people and provide a scientific background to several things that probably have been assigned cultural or spiritual connotations. And the last point there, when I was starting the podcast, I really did not think of it as a platform where we could have conversations that strengthen local capacity. But interestingly, when I speak with scientists across the continent, they keep talking about how things can be done better and how making effort to do things better, to engage stakeholders, to talk about what the government should do better, what key stakeholders should do better. So the platform, the podcast, has also become a platform for conversations aimed at strengthening local capacity, local African capacity, and thinking of what scientists and other stakeholders can do better to ensure that we maximize the African potential for research. So the format of the podcast are typically interviews that are usually in audio and or sometimes also video format, audio and video format. Or a few other podcasts are just in the audio format. And then I added webinars there because I would provide more details soon, but we will be having a webinar soon in collaboration with another amazing immunology organization, and just to still contribute towards amplifying immunology research across the continent. So these are key highlights of the podcast. So far, we've hosted and published around almost 20 episodes. So for now, we've published 17 episodes, but we also have some episodes that are in our database that will be published soon. So that's why we have approximately 20 there. The podcast has been listened to in more than 50 countries globally, and we have been listened to at least 2,000 times. And across, concerning the guests we've hosted on the podcast, we've hosted guests from over 10 African countries, including Nigeria, South Africa, Malawi, Somalia, Sierra Leone, and Senegal, amongst others. And I should just mention again that this podcast was launched in August 2022. So I would say we are in our 21st month at the moment, and it has been an amazing experience so far. So the themes explored in the podcast span infectious diseases, autoimmunity, allergies, cancers, and vaccines, of course, in the context of immunology. So some of our notable achievements so far are our graduate student series and our Day of Immunology event. So last year, we launched the first edition of this series, which the focus of the series was to ensure that we were also capturing the perspectives and experiences and work achievements of young immunology scientists from the continent. So we were able to reach out to 6 graduate students who come from 5 African countries, and we're studying in the UK, in US, and also here in Africa. And it was really an amazing series because it also helped us to break into a younger audience. We had more young people, possibly those who will be in their undergraduate or graduate, will be in undergraduate or graduate school, listening to the podcast because of this series. And we'll also be having the second edition of the series this year, and plans towards that already are ongoing. And then the Day of Immunology event. Last year, we had an event to mark the Day of Immunology. The theme for last year was Immunology Talks to Public Health, and we were honored to host Prof. Dimye Ogoina, who was a Time 100 awardee last year, and was recognized for his work towards Mpox, formerly monkeypox research. And so he talked about that interplay between public health and immunology in the context of Mpox, and some of the interventions that came about due to some of the interventions that were devised to tackle the monkeypox breakout. In 2022 it was declared as a public health emergency of international concern by the World Health Organization, and the fact that immunology contributed to the understanding of monkeypox and also informed public health approaches to managing the outbreak. And then this year we'll be having a panel session, and this week on Saturday, so everyone here is invited, and we are collaborating with Black in Immuno for this event. It's a panel session. We'll be having conversations around immunity, vaccines, pathogens, and aging. So some of our next steps are to improve our coverage of Africa. Like I mentioned, we've been able to cover just about around 10 countries, but Africa has over 50 countries. So we want to ensure that there is that diversity of the guests represented on the podcast. And so that's regards the countries we are covering. And also there's also the concern of language. Africa is highly diverse. Of course, English might be one of the most popular languages in the continent, but there are other languages that are spoken. So we that could be a bit complicated, but we are also thinking of how we can have the African continent well represented and catered to on the podcast. And then we're also open to partnership with local and international immunological societies, like the Federation of African Immunological Societies and the IOTS, which is the international body for immunologists globally. And just to mention that we for our events this Saturday, we'll be collaborating with a Black in Immuno, which is a non-profit for Black scientists, Black immunologists or Black scientists. That's also one approach towards this partnership. And documentaries. So we're also looking at being able to have documentaries about immunology, African scientists in the near future, and also engaging in more targeted public engagement programs. So you can connect and support our work. I am Wealth Okete on LinkedIn, Wealth Okete _ on Twitter, and you can send me an email, wealth.okete@gmail.com. Also, the podcast is only, for now, the podcast is only on LinkedIn and Twitter. Hopefully in the near future, we'll delve into other social media platforms. But for now, we are trying to maximize our effort on LinkedIn and Twitter. So on LinkedIn, it's the Immunology in Africa podcast. And on Twitter, sorry, now X, is immunoafrica _ You can also send an email to immuno.africa@gmail.com. So regards connecting and supporting, there are lots of ways you can support our work. And perhaps when you reach out, we can discuss further about that. Thank you. And yeah, thank you for listening. And like I said, I would like to say a big thank you to ISNTD and also appreciate the amazing team on the podcast. I work with a small group of volunteers who are committed to building the podcast as I am. And I want to say thank you to every one of them. And also thank you to ISNTD for this amazing opportunity. Thank you.
Thank you very much, Wealth. An amazing way to start this session. A lot of energy coming from your project, and we can't wait to see where this goes next. We will be there on Saturday. So thank you so much for sharing this with us. I'm going to hand over now to our next speaker. Joining us from the WHO's TDR, the Special Program for Research and Training in Tropical Diseases. It's really my pleasure to welcome you, Garry Aslanyan. You are running the Global Health Matters podcast. That's been, extremely well established, and I think everyone here will recognize this name. We'd love to hear a bit more about your story as well, how your podcast came about, and where it's going as well. So thank you for being here. The floor is yours.
Really great to be here, even if some of it probably is things that you know, or you may think that you know, but I personally am really new into this whole podcasting only around like 3 years now. And it all started by me looking for a global health podcast, thinking that why don't I go and get inspired, as I did by listening to other podcasts that were not global health, and then having not found one that was really to me, I said, well, what does it take to make one? And that's how it all started. And really, over the last 3 years, some of the initial kind of thoughts why we wanted to do the podcast came really clear and true. And recently in Nature Medicine, some of the guests that appeared on the podcast in the last 3 years and got together and wrote this little commentary about how podcasts are facilitating sort of cross-country, interdisciplinary, open, with not a lot of kind of hierarchies in terms of access into about global health issues overall. So it really reminds us that global health really is very interconnected area, and only by allowing diverse voices and open communication, we can achieve understanding of our issues, understanding of global health issues amongst those who are involved in global health, but also among those who are actually maybe not directly involved, but are interested in the topic. I heard from the previous presenter a very similar language in terms of democratization of the podcast being a way of opening and having access. A lot of the frustration I had in the last 25 years being involved in global health is that I went from one meeting to another, and people really in different fora do not connect to each other or are aware of all this, of each other's work. And it's not because they don't want to, sometimes they don't know how or where to find that information, or sometimes it's just not possible. So we're also hoping that the podcast here, ours and others that are being presented, contributes to that sort of breaking some of the barriers of traditional gatekeepers in knowledge and information. So for us, again, to reiterate that we're hoping to remove some of the silos in public health and global health, have some experiences from different parts of the world, and bring some new voices, especially from countries which is really along the goal of TDR and WHO overall. And also for global health professionals to find time to step aside from their routine and listen to some other experiences and reflect on their own work, and hopefully get inspired by the work of others in terms of doing their own work. So that continues, and we'll be doing this in our next season that starts in June. So we have a quite diverse number of voices that we were able to engage in the almost 35 episodes now. So this just gives you a sense of where they all came from. And here are some of the topics. Although we're TDR focused on infectious disease of poverty, or NTDs, obviously relevant to this audience, we have gone beyond that area only and looked at very wide range of topics, anything from geopolitics of global health to air pollution, or to water and sanitation, history, you name it. And we also introduced what we call dialogues, where in last season we had 4 one-on-one discussions that I had with some really inspiring authors or inspiring thought leaders in global health, where you would otherwise not have that opportunity to have that kind of an insight to that person, where they came from, what their story is, and why what they are proposing is on the table for people to consider. But we keep in mind that even being, as long as there's evidence, research, or people doing some of that, it really still is in line with TDR's overall mandate. And we also had opportunities to meet our guests at different conferences, meetings, and get insight into that. So it's virtually recorded, but every time I have an opportunity to engage with others, we do that as well. I don't know about others here, but I have no way of counting a number of downloads, except for the number of downloads has been going up. So that's the only thing I'm concerned with. From 2021 to 2024, we've only been going up in terms of numbers. And I don't know if numbers are really that important. I have situations where people reached out to me from some key institutions where they work on global health, saying that I listened to your podcast, or thanks for that episode. And if I even make a difference with this with one person, it is important as much as if it's in thousands of downloads, which I understand having thousands of downloads per episode is not a bad thing, but I don't know if number is everything. So important here is also we try to go beyond just the podcast itself by disseminating some of the learnings or some of the outcomes, key points, introducing the guests. So even if the person doesn't have a chance to listen to all podcasts, they can read a story, let's say in Health Policy Watch. They write about every episode that we have, or we send a newsletter, as well as have a website with resources that our guests give us to put. We also have done multilingual social media in terms of both promotion. I heard the issue around English and the sort of having podcasts in English, global health podcasts as well, similarly to the experience in Immunology podcasts previously in Africa. Obviously, it is continuing to be a limitation, but we have transcripts about 4 or 5 languages available if our listeners want to follow that as well. And we've done some social media outreach in different languages as well. But it continues to be an issue in terms of sort of reaching every ear that is eager to listen, but is not able to understand everything because it's in English. That continues here. So these are the examples of translated transcripts and also promotion and how we share the episodes where relevant, especially if the topics are relevant to particular part of the world. We're also trying to engage kind of global health community virtually in terms of people on Twitter or through email they send. We're planning to having our guests write op-eds that will then appear in the global health sort of blogs or global health outlets, not scientific, but more information sharing, using the experience of the podcast and using experience of the discussion, and maybe bringing some of the guests to do that together to amplify the reach of the episode or some of the episodes. As I mentioned again, at some time we also meet our guests or our listeners. We get audio messages from some of our listeners. We play it during the episode, and wherever possible at various conferences, I have an opportunity to meet, discuss with some of the listeners. But if possible, I record a little video. In fact, a couple of videos came out today from a major planetary health summit happened last week, as well as we've hosted 2 specific global health communication workshops where possible on the sides of big conferences, because one of the things we've realized that continues to be a major gap in terms of the skill set that everyone working in global health needs. Maybe not everything, but at least some of those who want to, or not everyone, but some of them who want to improve their skills. We've done a couple of specific workshops. And of course, podcast is only one way to do that. In terms of some of the numbers, in terms of number of followers and LinkedIn, Facebook as well, and Twitter, and our account gained a lot of new followers. And we've received some feedback in terms of how our episodes are used in teaching, in courses where global health is a course. And they've, in fact, I've heard from a couple that they've assigned that in their listening, not a reading list, which is probably a new thing. and some of the feedback as well is here. So we also hope that, or we know that it's not just plays a role of information sharing or learning from that episode, but also can be an educational tool. It takes a whole group of people working. I think important here for those who want to start or look into starting a podcast. These are some of the roles that people have, but it's really a good technical global health research or global health practitioner experience is needed, because every episode we do a due diligence of researching that topic, looking at the challenges, looking at the gaps in knowledge, controversies, if there are any, players, etc., etc. So that has to be solid. We're not a news sort of agency just reporting. We want to make sure that our audience, and I know from comments to me from our listeners, is that sometimes they say, I trust you to ask the right question. I've heard that so many times. And that is extremely important, because the listener feels that I'm doing this on their behalf and asking questions that they would have asked. Then multimedia and mixing, audio engineer, editor, that's an important skill which we have in our team. And then, of course, communication expertise in terms of how to reach those who would want to hear about us, who would be open to listening or promoting the guests with them. So exposing that as well. And in terms of distribution and marketing of the podcast. Marketing sounds maybe negative in what we do in global health, but at the end of the day, it is that kind of a skill that is going to be applied for this kind of a product, which is a podcast. So some of the lessons we learned is that we have to really always balance the facts and experience. We need to be solid. Storytelling is very accepted and very welcome by our listeners. We always, not every topic is a podcast material. Needs to have a good angle because it's a very different kind of a medium. Right questions, the art of asking the right questions in the right time. A lot of preparation, planning needs to go into it. You cannot just go into it without it, simply because of the broad range of issues and types of guests we'll have. We also try to disseminate sort of tailored material from each episode in different ways, as I said, in takeaway messages or key points. So just to say that sometimes it looks easier than it is. It is time consuming, not to scare anyone, but just to realize that, and not to also think that 1 or 2 episodes are going to gain you thousands of followers. Go and continue and don't give up if you start. As I said, again, it's not a tool for every topic or every kind of conversation. Then the way how we acquire information across different cultures and how people present, you have to be really aware of that diversity, including, if needed, switch to different languages and get the point before going to English, as in preparation. But language continues to be an issue. The actual airing episode and guests speak English. I also don't know if this is the same for others. Maybe you can reflect on this. But out of the 180 countries, not all regions are equally distributed. There are places where podcast is something consumed more than in others. That's also depending on the culture of the place or how people listen to it through podcast apps or through YouTube or other ways. So that we found to be also interesting to keep in mind. And of course, the experience in the last few years have given us that sense when we plan an episode about a certain part of the world or a certain topic that is more relative to other parts of the world, where sometimes podcasting is more or less, or how people consume that information. So again, similar to some of the plans, we want to create more content for LMIC audiences, new connections with other key global health players. So the outcomes of the discussions are having an impact in terms of people reflecting on the work and broader sort of multiple subtopics and coming up with topics that grab people's attention, because there's so much one can learn, as well as time that people have in terms of consuming a whole bunch of information bombardment that they have. I think that brings me to the end of the quick presentation. I'm happy to answer any questions or get into more discussion. So if it's okay, I am done.
Garry, thank you so much. That was really brilliant to hear how through this podcast, you're really echoing and amplifying the mission of the WHO's TDR, which is really centered on this capacity building. And you mentioned breaking down silos, all that around tropical diseases, and particularly for those in endemic areas. So thank you so much. That's been really wonderful to hear more about. I'll turn now to a third podcast that is being presented as part of this series. A bit of more of a broader remit in terms of infectious diseases, but it's my pleasure to hand over the floor to Jame and Callum, based here in the UK, where the ISNTD is as well. You'll be talking to us about your very amusing, useful, informative, wonderful podcast. We look forward to hearing all about it. The floor is yours.
Thank you very much, guys. Welcome to the IDIOTS podcast presentation. That's Infectious Disease Insights of Two Specialists and presentation. I'm here on the left as a green, negative, horrible bacilli, and here's Callum, a wonderful, round cockeye. So Callum, next slide. Why exactly have we done this, subjected the loyal listeners of the IDIOTS podcast and everybody on the webinar here to our musings over the past 3 years?
Yeah, so we're going to talk you through why we set the podcast up, what's in the podcast briefly, how we did it, who's listening, and some thoughts about that, and then what's next in the future. So why did we set this up? Well, I think as one of our previous speakers alluded to, it was 2021, and for no particular reason, Jame and I were both spending a lot more time at home, and we were both working in infectious diseases and preparing for our infection exams, and we were thinking, actually, there is a lack of resources available for us to learn the basics about infectious disease and medical microbiology. And that put us on a path to thinking, well, I guess I approached Jame and I said, I think that there's a gap here for something that's for more junior people that's covering the basics. How did you feel about that, Jame?
Initially, I guess I would say I had some trepidation about putting myself out there as a font of knowledge, or as a resource to be scrutinized. Any mistake that we make would be sort of immortalized in audio, although actually we've now realized that it is fairly easy to go back and fix some stuff. We were pretty keen not to be seen as experts in medicine. At the time, I hadn't finished training. We were both still registrars. And we regarded ourselves, or I regarded us, as two idiots who didn't really know very much. And then we sort of came to the realization that that might make us actually ideal, as we were sort of our own target audience, two people that didn't think they knew very much, and we could leverage that into creating an infection podcast so easy that two absolute simpletons could run it for 3 years and counting. And so with that, I came aboard and we began to plan what we were going to do. So I'll take this next bit, Callum, if you don't mind. So what are we going to do? Well, we could talk about anything, really, if we want. Infectious disease is functionally infinite, and there's so many resources. But at the time, we were revising for the infection exams in the UK. And so this next slide shows the Oxford Handbook of Infectious Disease and Microbiology. I'm sure many of you are familiar with it. And we've highlighted two sections here. One is on the drugs, and the other is on the bugs. And how I revised for this, because I was a bit time pressured, was I just made mind maps of every page in those two sections. So at the end of it, I had information on every bug and drug that this Oxford Handbook thought was of interest to infection clinicians. And then we sat the part one and passed it with what can only be described as gliding colours, but pass it we did. And so then that sort of became the framework for how we were going to start the show. Next slide, please, Callum. We've deviated from this a little bit, but the sort of plan remains the same. We're going to try and cover all of the bugs, starting with bacteria, and then moving through sort of viruses and fungi as time goes on, and then all of the drugs, starting with the antibacterial antibiotics, and then moving on to antifungals and antivirals and things like that. Whenever we get bored, we have deviated from this, covering certain syndromes like pneumonia and endocarditis. We've got a urine mini-series called Taking the Piss on the diagnostics and management of UTI, and then a Prepping to Pass mini-series focusing on the UK and US infection exams. Neglected tropical diseases have currently been neglected, I'm sorry to say, but they are certainly on our roadmap to be covered in the future as they come up. So, like, that's the sort of what, Callum. Why don't you talk to us now about the how we actually go about doing the podcast?
Yeah, so when we set out to doing this, we were both completely unfamiliar with how a podcast works and how you set it up. And so it's been a bit of a learning curve, and our process has changed somewhat. But for anybody listening that's interested in setting things up, as we've heard from our previous speaker, you do need to prepare what you're going to talk about. And the way that we do that now is we use a website called Notion and plan, and mainly Jame does all the preparation about what we're going to talk through and have a rough structure to talk through. Although we don't just read that off verbatim, but you do need something to base your discussion on. But really, to start setting up a podcast, all you really need is a podcast host or two, a website or some way to share your podcast. Some sort of cover artwork. So I've really enjoyed the other two speakers' artwork. It's really engaging. So that's important. Decent microphones. So this is the Blue Yeti pictured here, which is a very affordable entry-level microphone that sounds, we think, okay. We need a means of recording. We're based in different places. So we used to record over Zoom, but now we use a website called Squadcast, which records the audio and then some way of editing. So we used to use a free software called Audacity, which we'd really recommend. A bit difficult to get to use, but it's free. We're now using something called Descript, which has the benefit of making a transcript, and certainly having transcripts in different languages would be a great next step if we were able to do that. And then finally, you disseminate your podcast using a hosting website, which automates a lot of the work about getting the podcast audio into different players. And we use Buzzsprout, but there's many available. And then finally, I guess in terms of communicating, there's no point in recording a podcast if nobody's going to listen to it. So there's a lot of activity on Twitter, and that's where we find we've had a lot of uptake. So if we think about where we went from here to starting out and nobody was listening but our mums, although actually my mum actually listens. So to getting to where we are now, it's been a bit of a journey. So we started out in July 2021 or thereabout, and you can see that at the beginning it was slow going in terms of the uptake. But we stuck with the process and then started actually saying to people, oh, actually, we're doing a podcast, because I don't think we'd really communicated that up until joining Twitter. And the real turning point for us, and this was mentioned at the beginning, was guesting on Febrile with Sarah Dong. So we're very grateful to her for sort of helping us get set up and giving us some advice along the way. And that was a real uptake. And we've collaborated with some other podcasts. So Let's Talk Micro, done by Louis, focusing on microbiology, and Microbe Mail, which is done by Vindanya, who's based in South Africa and takes a sort of approach from LMIC in terms of microbiology, and that's been really helpful to our journey. Clinical Conversations is a sort of more it's done with the Royal College of Physicians in Edinburgh, and going to conferences and just getting word out. So that's sort of where we're doing with numbers and how we got there, and just thinking about where our downloads are coming from. So I think it kind of makes sense that the content that we're covering is from a high income country, and so that's sort of where our listenership is. It's something, infectious disease is a global issue, so I think there's some way for us to go. And we were just looking, recently through the literature about where these podcasts are getting downloaded, and this paper was done looking at internal medicine podcasts, a series of 5 of the sort of most popular internal medicine podcasts globally, and overwhelmingly these were being downloaded in high income countries. And so that paper explored some of the potential barriers to wider uptake, and looked at really specific things that have been mentioned already, such as language, what the content of the episodes are. So I guess some of our episodes are more applicable to people working in low middle income countries than others, where we're talking about more sort of hard to access investigations, etc. But this is essentially where our listeners are. Jame, could you maybe tell us a bit more about who they are and what they think of the pod?
Yeah, sure. So we sort of conducted at the 2-year mark a sort of survey to sort of see who our audience really was. We'd had a little bit of feedback, an email here and a tweet there, but we didn't really sort of know. So on our 2-year anniversary, we sent this out. We got about 56 respondents. And of those, about 2/3 are doctors. And the makeup of that 2/3 were about half were doctors in training. About 1/3 were at senior levels, so consultants or SMOs, and the remainder were early years graduates or people not yet working in infection medicine. And in terms of specialties, almost everybody was working in microbiology, infectious disease, or both, with a small handful of physicians and the odd GP and pediatric doctor. And as for the non-doctors, it's something of an eclectic mix. That's the bottom right that you see here, ranging from clinical science trainees in infection, biomedical scientists or their US equivalent, and ID pharmacists. And a special shout out to the single retired coffee shop owner whose specialty was stated as coffee. Next slide, please, Callum. And so then we asked for some sort of verbal feedback, and here's sort of a select quotes, specifically the one that we selected to make us look as good as possible, but broadly reflective of what we got. People appreciate straightforward but detailed and clinically relevant explanations of important and interesting topics with some banter thrown in, which could be written on the gravestone of the Idiots podcast when it finally shuffles off this mortal coil. Callum?
So yeah, I guess some more general themes that we got from the audience survey and feedback in general was that our listeners reported that they enjoyed a conversational style of podcast, that they enjoyed good audio quality, and they found humor. I'm not sure if there was any in there, but they felt that would be helpful. And things that they struggled with were maintaining attention, particularly when they were distracted with other things that were going on around them. And again, looking to the sort of literature around podcasting. So this is a qualitative study done in North America, and Riddle and Al looked at did a thematic analysis of people's experience with podcasts and came up with the three main themes of personalized learning, opportunistic engagement, and community. And I believe that there's been a session at this meeting already around how you build a community. So I guess this is suggesting that although podcasting might seem like quite a distant thing, and I was surprised in this paper that actually building that community can be a real strength. Not only the interaction in that sort of conversational tone, listening to your hosts, but also talking about the podcast with your peers or with your mentors and faculty within the place that you're training. So that was, a kind of advantage potentially that podcast was coming out with. And certainly we found that as we've grown in reach, that when we go to conferences and stuff, we are meeting people, and we're learning that actually this is a benefit to that. And I guess other things just briefly around podcasts in general. So that personalized learning, we're sure all aware of that we may have, 78 episodes, but each person will decide themselves which episodes they want to listen to fill their knowledge gaps on things that they're not aware of or things they're interested to. And there's a real pressure to study, and there's so much to cover within, global health and infectious disease that it is very easy to get knowledge gaps. And then finally, we're hoping that this is something that people can listen to when they're on the go, they're doing their washing, they're driving the car, or it's also entertaining, because certainly I find myself trying to keep up with all the information that I'm expected to learn is a bit overwhelming at times, and maybe something a bit more fun can be helpful. So over to you, Jame.
Yeah, so that's what we've got. Last month we reached over 150,000 downloads. We're up to 70 episodes now, more puns than were strictly necessary. And we're really happy to have reached this milestone, and glad to get the feedback that we've had and that people enjoy the content and find it useful. A special thanks to Sarah Dong and the British Infection Association, who have been essential with keeping the podcast going.
So I guess whenever you're having a podcast host, it's much easier to share the workload. It was a very impressive team that we heard about, but it's just Jame and I doing the work. So me as the host and Jame as my assistant deputy sub co-host, which I didn't title him. He chose that title for himself. So
no.
Thanks very much for listening, and thanks to all our supporters.
Well, thank you so much, Jamie. Thank you, Callum. Congratulations on that amazing landmark, 150,000 downloads. That's quite something. And I actually felt like I was in one of your podcasts. The voices kind of become very familiar, and that was really informative. Thank you, especially down to those very practical details of what one might need if embarking on such a project. So thanks a lot for those insights. We were joined during your presentation by our last speaker for the session, Desmond Jumbam. Welcome. Thank you for being with us.
It's great to be here.
So you're part of an extremely exciting team that runs the Global Health Unfiltered podcast. And you're here today to talk to us a little bit more about your podcast, what you do, how it relates to global health, tropical diseases, but also other broader cross-cutting issues. So we're delighted to hear from you and welcome you. Over to you.
Thank you so much, Marianne. It's a pleasure to be here. Thank you for inviting me. And I'm sorry for being late. I missed some of the other presentations, but I hope that we can engage a bit more during the Q&A session. So our podcast is called Global Health Unfiltered, and our tagline is, it's a podcast and blog about the unspoken realities of global health in Africa and the world. The blog part we added a bit more recently, and I'll take you through why we decided to include the blog aspect a bit later. So Global Health Unfiltered started back in 2022, and I think it was one of the many bazillion podcasts that started during the COVID pandemic when people were at home kind of twiddling their thumbs and engaging in various discussions. And, many people had the idea that, oh, this conversation that I'm having with my friends could be a podcast. So, at that time, my co-host, Ulrich and Ella, we were having discussions around decolonizing global health because right around COVID-19, there was a lot of, it seemed like the number of papers and webinars and just the overall discussion around decolonizing global health had skyrocketed. But we realized that this was a good thing, that people are talking a lot more about how do we address some of the institutional challenges and racism that are in global health. But the challenge that we saw was that much of the discussion was being um, held and led by institutions that are based in high income countries. Which there's a certain irony about that. We were based in Ghana, and we found that there wasn't much that was being discussed around decolonizing global health in Africa and in low and middle income countries, not as much as was happening at high income institutions. And so we also realized that the discussions around decolonizing global health was perhaps being skewed towards what Jame has called the foreign gaze, where the discussion is not really talking about things that are necessarily of highest importance to researchers and public health officials in low and middle income countries. So that's one of the reasons why we created the podcast, was to create a platform where researchers and public health officials from low and middle income countries could come to discuss decolonizing global health, among other topics. The other reason why we created this podcast was because we also realized that there was a lot of really important global health work that was being led and done by public health officials and public health researchers and students in low and middle income countries in Africa, but oftentimes they were not being acknowledged and recognized for these work that they were doing. And so part of the reason for this podcast was to highlight their work and showcase some of those impressive work that they're doing. So I'll give you a few examples of some of the folks that we've highlighted. So we started the podcast in 2022 as a result. So these are the two objectives of our podcast. The first is to showcase the contribution of African public health leaders to addressing perennial global health challenges. The second is to expand access to the decolonizing global health conversations in Africa from the perspective of African researchers and public health practitioners. Our team has grown significantly since then. We started off as just the three at the top: Desmond, Ella, and Ulrich. And as of last year, we had Yao Bediako, who's a infectious disease and biotech founder in Ghana, join our team. We have Diana Koma, who joined as a producer last year. I think she's worked a little bit with you, Garry. So she joined as a producer last year from Malawi. And then we have Ivan and Chisomo, who are research interns. And then Beverly Defoyne, who leads our communications. Here are just some high-level stats as to what we've been able to do since then. We're now in our third season. We've published 27 episodes, and we've had guests from 10 countries, most of them from Africa, but we've also had guests from India and Pakistan and other places. We have 4K followers on social media and 80 members, and our listeners come from 64 countries. Here are just a list of some of the topics that we've covered throughout the 3 seasons that we've been publishing episodes. And you can see that we cover a wide array of topics. So you'll find that about 50% of the topics that we covered are what we would call, the unfiltered topics. This would be things like the foreign gaze and decolonizing global health, decolonizing our minds, dependency on health financing in Africa, and then the rest are either focused on highlighting public health officials or discussing topics like tuberculosis, that are more broadly, raising awareness about some of these issues. We've been asked how we determine what to cover on the episode, on each episode, and I'd say about 50% of the topics that we covered are pre-planned. So every year we meet as a team and discuss, what are the issues that we definitely would like to cover for this coming season, and so we plan around that. And then the remaining 50% of the topics are a bit more contemporary, a bit more kind of what's happening in the news, what is relevant. And so some of them are a bit more spontaneous, where there's something that, for example, we have an episode that's coming up this week that is focused on the doctor strike that is currently happening in Kenya. So that's a topic that we just decided to record last week, and we did it because it's very relevant to Kenya and many other places. This is a list, 3 of our most popular episodes, and you'll notice that there's perhaps a theme among these 3 episodes, is that they primarily focus on decolonizing global health, and they are 3 of our more unfiltered episodes. We had Sheam Bimbola, the former editor-in-chief of BMJ Global Health, talking about the idea of the foreign gaze in global health. We pay undue attention to people that are outside of the communities that really need those interventions, that really need the benefits of that research that we're doing. And so this leads to many other issues. We had Dr. Catherine Chobotingi from the African Population Health and Research Center out of Nairobi, talking about how we also need to decolonize in our minds. It's not just about those systems, but she said that the African mind is still colonized in many ways. And so that, and very similarly, Prof. Iroka talked about how we need to challenge the dominant global health narratives. I think a theme about many of these episodes is that they're very interactive, and it allows for people to engage with the episodes on not just on our podcast platform, but on social media and the like. Here's where our listeners are coming from. So this is a podcast that, we're very intentional about our target audience. So we really aim for our contents to be targeting the African population, practitioners, but also very, very globally. So most of our listeners right now come from are based in North America. 26% of them are in Europe, and then 21% are in Africa. And so this is, I think this is a good thing, but it also shows that we've got some work to do. Part of the challenge with podcasts, I'm sure fellow panelists will attest to, is that podcasts are growing in regions like Africa significantly, but they're still not as popular as they are in Europe and in North America, and they're not as popular in Southeast Asia and Latin America as well. But at 29%, I think we're doing decently well. One of the things that we have done to expand the reach of our podcasts in Africa in particular is to introduce a YouTube channel where video recordings of our podcasts are published. So we find that YouTube is a bit more popular than podcasts, even though podcasts are growing on the continent. These are some select comments from mostly Twitter, from some of our listeners, attesting to how and why they enjoy the podcast. Again, these are the ones that, like our fellow panelists before, showcase global health in a favorable light. But we enjoy reading these comments because it's encouraging to see that this podcast that we started with barely anything is having an impact and people are enjoying it, and we've had people reaching out to say that they're using it in their courses to teach their students. So this is very encouraging. Last year, we received some grants from the Decolonizing Global Health Research Network, a conglomerate of different decolonial scholars. And that funding, we're very grateful for it, allowed us to produce our second season. Our first season was very much self-produced, just us. I learned about audio editing and design and publishing and all of that. And I think it was a good way to start. With podcasts, you just got to start and then you improve over time. But the quality of our podcasts from our first season can attest to the fact that I was still one doing it as opposed to a professional producer for the second season. That really helped us to take up the quality. But one of the things that we were able to do last year was to launch a website. And this is an additional platform where people can go and listen to our podcast episodes and get additional information about the podcast. But the most important thing that the website does is it introduces another platform where students and researchers and public health practitioners can share their perspectives from their communities about global health challenges. We want to elevate the voices that don't often have a platform, but you can only have so many guest speakers on your podcast. And so we launched a blog for primary practitioners from LMICs to share their perspectives on various global health challenges in their communities, various global health issues and solutions that they've encountered. And I think the podcast has been growing so far. We've gotten a lot of interest from students. We've published 30 blog posts so far, mostly student authors. So we actually spent a bit of time helping those students refining their submission. So it's not just that we reject all the ones that we don't think are up to par, but we work with each of those students to improve the final manuscript and to help them improve their arguments. We have submissions from all around the world, and viewership of those posts are growing. So we also had an op-ed training session where we trained anyone that was interested on how do you write a compelling argument, how do you write a compelling opinion piece for change. We had more than 50 students attending that session. It was recorded and published as an episode, and it's also available on YouTube for others. And we launched an op-ed competition last year, the annual op-ed competitions. We had over 300 submissions from around the world covering a wide array of topics. And these were our final top three candidates who received a cash prize and publication of their piece. So this is one of the ways that we're going beyond the podcast to elevate voices that don't have a platform around global health, that may not be able to access the more prominent global health podcasts or platforms that are out there. At a very high level, these are some of the enablers and challenges that we've encountered. The first is we have a great team. We've got a producer, we've got a comms person that has really helped us to grow the work that we're doing. We've been able to acquire professional hardware and software that makes all the big difference. We're incorporating a lot of AI into our podcast producing systems. We also have a lot of advice from mentors like Shiam Bimbola and Davide Bilardi from Oxford. And the positive feedback that we receive is also encouraging. In the past we had some challenges in identifying guests. That's not as much of an issue now because we've introduced a guest nomination system on our website where people from around the world can nominate guests to come on the platform, and that allows us to have access to guests that we would never otherwise know about the work that they're doing. And then we're also growing our YouTube and TikTok platform, although that requires a bit more work, and funding remains a challenge. So we're developing a business strategy and a business plan around how we generate sustainable financing for the podcast. A few lessons learned finally is, we learned that you just got to start with what you have. There's a tendency, and part of the reason again why we developed the podcast is there was a lot of discussions around decolonizing global health. We don't have our own platforms to talk about these issues. We don't have our own platforms that that cater to a local gaze. But rather than just complaining about it, we decided that we would do something about it. And we started with what we have. We bought a mic and figured it out. And over time, we've grown in our expertise in this area. The second is stay true to your vision. The two main objectives that we had has been our vision from the start, and we maintain that vision as much as possible, even though we may be tempted to go into other areas that are enticing, but people come to us because they like the unfiltered content. Sometimes some people say it's too unfiltered, others not so much so. But we've remained true to our vision, and we try to be as inclusive as possible, trying to get guests from places that we would never know about and covering topics that we may not be aware of. So we reach out to a wide variety of people, and we have the blog as well, so that as many people have a voice as possible. And I'm sure other podcasters would testify to this, but quality is the name of the game. It's very important to maintain the quality of the production, the quality of the audio and the video that we're doing. So we're constantly finding new tools that will allow us to improve and maintain the quality of our podcast. So a big thank you to my fellow team members and to the decolonizing, to the Decolonization and Global Health Research Network, as well as to all of you who have listened and support the podcast. Thank you very much.
Desmond, a huge thank you to you as well for sharing some amazing insights into how your podcast has grown. Thank you to all our panelists, actually. I think for some of us, this is all quite new territory in terms of how to make a podcast and why. And yeah, it's just been a real pleasure to have such success stories come together. Anything really that can highlight the work around neglected tropical diseases, but also scientists in the affected regions. It's always a pleasure to hear from. So thank you. We do have a few minutes for a discussion, and you've given us so much food for thought. There would actually be a lot to talk about, and clearly your podcasts have been very successful. But I was curious whether there were some challenges or some things that have, amidst all that success, gone wrong, things maybe you didn't expect, which you encountered over the years. Is there something intrinsically to podcasts that can can be difficult, and what might that have been?
I could talk about one thing if that's all right. I'm not sure that I didn't expect it, but I think it's something to be aware of if you're getting into the space, which is that initially, unless you are phenomenally lucky, it will be really slim pickings for the first year or two.
Mm-hmm.
So we're at 150,000 downloads right currently. I think half of that is in the previous 90 days, because we're on a sort of an exponential sort of curve bit at the moment. Yeah. And it's always sort of looked like that, except at the end of the first year, we had something like, what was it, Callum? 1,200 downloads, something like that. So maybe 10, a tiny proportion of what we've got now. And then it's sort of, we've had a couple of bumps joining Twitter, and the ID Twitter community was one bump. Going on February was another significant bump. But actually, if you look at it on that, what we presented, it hardly looks like anything, but that's because all the growth has been after that. And I think our first month we got like 4 downloads, and one of them was me checking that the download worked, that kind of thing. I'm sure everybody's got a similar story to tell, And so I think if you're going to make a go of it, and if you think about doing it yourself, you need to be prepared to give it a year or two if you're going to get even the sort of moderate success that we've all had, and everybody's sort of in the same ballpark really here. If you standardize by when we all started, it seems that everybody started basically in the middle of the pandemic. But yeah, that's true of lots of other. It's true of Microbe Mail. It's true of Febrile. Let's Talk Micro. Yeah. This sort of new wave of infection and NTD podcast that seems to have come to the fore.
There was a lot of nodding while you were saying that, Jame, so I think everyone agrees with you in terms of the time it takes, the bump and the bumps along the way. Does anyone else have something to add to this? Yeah.
Maybe not a challenge, but a pleasant surprise that I don't know how we would produce a global podcast with global guests has it not been for pandemic and the ability of people. I don't need to train them how to put a headset or speak to a microphone or choose the right connection or change what needs to be changed. I mean, very little and very little sort of training for that. And that's how we have guests from all over the world, really. Otherwise, I will never have that kind of guests lineup. We'll have to galvanize around the world, talking to them in some corners or whatever. So in a way, podcasting has also grown due to the fact that now people use more sort of this kind of technology and are more used to this kind of stuff. So I think it's for us, it's been a positive thing in terms of the nature of our podcast being really global and ability to connect and easily access our guests.
Excellent point, and definitely something we experienced here at ISNTD as well. Desmond.
Yes, no, I very much agree with Garry and the previous comment about the podcast growth. I think consistency is the name of the game. So you've got to be consistent. In our second season, we saw that downloads went up by 250%.
Wow.
which is a good thing. But we started off with just us as the downloaders.
Yeah.
So very much agree with that. And to Garry's point, yes, the COVID-19 pandemic really helped to democratize everything, including podcasts. But part of the challenge that we still experience is the fact that internet connectivity is still a major issue in many parts, and many of the guests that we come, not as many, but a few, have internet connectivity issues, which, we use a platform that allows that records locally, but if the internet connection is still poor, then it makes it hard to to engage in the conversation because you're breaking up and stuff, and that affects the quality of the podcast episode as well. So there's been a trend I've noticed among popular podcasts doing the episodes in person. A lot of those who can afford it are flying their prominent guests or flying to their prominent guests to do the recording in person again. And this is because it allows them to control the quality of the video. There's a lot of video podcasts that are happening now, and it allows them to. And the reality is, having a conversation in person and having one on virtually, it still creates a different dynamic. So, that trend is a trend that I'm noticing, and I wonder, if this is a direction that our Global Health podcast will take.
If that will continue.
Yeah.
I suppose that's true, actually. Me and Callum, because we were friends before we started the show, we have, even though we've always done it remotely, a sort of natural communication style. And we've not had a lot of guests on. We're not really a guesty kind of show, but we've had a few on. And then it's not that it's awkward or anything, but certainly the dynamic is slightly different depending on who they are. And you're right. When you're meeting somebody for the first time over Zoom or over whatever you're using, it's difficult to replicate that natural communication style.
Well, then, Callum, did you want to add anything? Maybe some of the unexpected challenges? Yeah.
I was going to mention something. Desmond just talked about internet connectivity. Yeah, I think that's a case. But strange enough, I've been the one having internet connectivity issues sometimes during meetings, and not my guest. But of course, that's a challenge, and sometimes it affects the flow of the conversation and the quality of the output. But then something else I wanted to chip in was regards podcast, the popularity and acceptability of podcasts in Africa, particularly podcasts that tilt towards health, infectious diseases, and some of those kind of medical or biomedical topics. Of course, there are lots of successful, very, very successful podcasts in Africa, but I'm not sure. I doubt if they are really in that health category, global health category. Like Desmond highlighted the fact that for the Global Health Unfiltered podcast, majority of the listeners are in North America and around Europe, and even for Immuno-Africa, although on Spotify, we have like majority listeners from Africa, but Spotify just has like 1/5 of our listeners. So I'm quite sure like Apple Podcasts has like also a very high number of listeners. Maybe it would be individuals in America or the Europe who would be listening to the podcast on Apple. So I think that maybe podcasting, it will take a long time, maybe a while for Africans to really get used to this kind of podcast, particularly podcasts that cover health-related topics. But I'm also thinking if it were possible to find out alternative avenues that are still podcast styled that would cater better to the audience, because for a podcast like Immunology in Africa podcast, there's already that factor that, of course, it's a global podcast. Anyone can listen to it and benefit from it, but we want Africans to listen to it, to hear the work of their own scientists and see what they are doing, to hear their own scientists combat misinformation and myths and educate them about science. But it probably will still take a while to break into the African populace. But then I think it might be possible to explore alternative avenues to ensure that we get that break into that get that access that we need to break into the African space. Of course I can't cite examples now, but I think that's something that podcasters in the continent can be thinking about, if there are alternative approaches to explore that will be more appealing to Africans to listen to this kind of podcast. Yeah.
That's a really good point, Wealth, and actually was going to possibly link to my next question. It seems to me, but I could be wrong, we're talking about audiences, that sometimes when it comes to podcast, even just that word, And it's not very complicated to access the podcast, but I wonder if some audiences don't think, oh, well, it sounds a bit complicated. Do I go to Spotify? Do I go to Apple? And maybe in the same way that RSS feeds were very useful, but then maybe some people just didn't embrace that. And with, for example, radio being so used across the African continent, whether you felt there were any partnerships or just anything that could be done, who's missing or what's missing to make the material, the content more accessible. What would you like to see more of, whether that be more partnerships with radios, as the example I just gave, or funders, or how could this, it is amazing content. There's so much of it, so diverse. How can we boost that uptake? I'm not sure if anyone wants to go first.
Yeah, I don't know really. I put a paper in the chat, which is looking at exactly that question and trying to answer it. And they look at different media formats and say, you know, where's the uptake and why is it different? And I can't remember who made the point about YouTube, but I thought that was a really good idea. It's like, what platforms are people using, and then try and use those. So blogs, you know. So that's something that we don't do, but it sounds like other people here do. And maybe that's part of the answer is just giving people the content on the platform they want it on.
Yeah, well, Desmond, your show seems to be quite, you know, diversified with blogs and outreach with multiple social media channels. Is that where you've noticed the big uptick with that, or do you think it's just time related?
I think it's time related, but I think it's also content. So the content that we do, we're clearly have the African audience as our primary audience, so we try to start with that. You know, the content will draw the audience. So if we have, for example, an episode about TB Joshua and faith healing in Nigeria, that episode, you know, is going to get a lot of attention from not only Nigerian listeners, because that was a contemporary issue that they were dealing with, but it's going to get attention from other African folks, because that's an issue that is of interest to them. So that's the first thing I would say. It's the content really to their gaze, right? The second is the platforms, right? I put in the chat. You know, AfriPods is a group that is trying to curate podcasts for an African audience. They're not just you know, hosting, but they're trying to, like Spotify, help African content creators create more content for African. So they're doing their best. Wow. They've got some really good podcast episodes on that, and it's gaining popularity. But I think they still need to do quite a bit of marketing, because, for example, if you put your podcast on some of the more prominent websites like Spotify and Apple, you'll still get a few downloads, right? We've put our episodes on AfriPods, and up until now, it's been a couple months. We have 0 downloads. So unless you're one of the podcasts that are already popular on their platforms, you would need to market it. And I think it's also on their end to do a bit more promoting of their platform so that it gains popularity. And then the last thing again is YouTube. You know, YouTube is still very popular, and I think many popular podcast platforms are using YouTube just because of its global reach, but also because it's easier to monetize on YouTube than to do that through podcasts. And I think social media is also great because we share those sound bites, and the sound bites really go far.
Oh, do they? Okay.
And yeah, they really do. TikTok is a place where we're trying to grow a bit more in, but I must admit that it's a platform that I don't understand. It's you know, but it's very popular.
Yeah, you're not down with the kids, is what you're saying there, Desmond.
Well, something like that, yeah.
It also keeps changing. That's the other thing. The content.
And it may be banned soon here in the US, depending on what Congress says. So we'll see.
Yeah, well, that's a problem, isn't it? We sort of it's not exactly the same, but we, to promote idiots, we thought we'd do some advertising on social media, and we joined Twitter, and then Elon Musk bought Twitter, and then Twitter went down the toilet, and so it looks like a bad idea, but actually, ID Twitter, this little niche corner, has been relatively preserved and is still relatively fun to interact with. So as long as you stick very much in that area, I still find it's beneficial. But we've joined that specifically just to advertise the show and not do anything else. So that makes it very easy to just kind of stick to the message, so to speak, and not get into strange arguments about bathrooms and what have you.
Interesting, but I second that opinion. We stick to tropical diseases, and I recognize lots of names in the people who registered that are doing comms in tropical diseases. Twitter is amazing. It's our home. It's a safe space. But yeah, don't discuss anything else. Well, we've already had a lot of your time. Thank you so much. We've really learned an incredible amount from you. We're very grateful. We do, just to kind of wrap up this session, and there would never be enough time to discuss this growing movement, just to finish maybe on a few thoughts looking to the future. Desmond, and all of you, many of you actually launched around COVID. We also launched the dreaded W word, webinars, in COVID. So I think we're all kind of in the same boat. Desmond, you gave us the official statistic, which was a gazillion. So 3 years down the line, how have things changed, and what maybe do you see as the future for podcasts? We've heard a lot about impact and not necessarily numbers. We've also heard about, bringing in other complementary communication forms to support the podcast. Any pointers as to how this amazing genre might evolve? And particularly focusing for the scientific community.
It will probably evolve, but not for every topic. I mean, that is clear. To me, it may not always work for things that require more visual and more, and different people actually consume information differently. So you're always going to have people who would love podcasts and people who would love videos, and others would want to read. Oh, there are people who want to read. Oh, I don't know, maybe no more. Or read 3 sentences. That's what we do now. And I mean, the number of people that I write emails to and they only read the first part, I remember the next time I should just write the first part. So that will change. But I mean, we probably will have podcasting as one of many other things, right? It will improve and be more probably used, but it won't be for every single kind of topic. Just to I think that's what I think, but who knows, right?
Yeah, I think. Sorry,
I was just going to mention I've put another paper in the chat which is about looking at podcast developments over the last 10 years and taking a lens of disruptive innovation and how that looks at it. And I think that they have some interesting insights into like what it is that makes these things sustainable. And it was really interesting hearing from others about like the background, like the team behind the podcast. Because that, there's obviously like, Jame and I are kind of just a little bit DIY and sometimes feel like we don't know what we're doing. And then you've got the contrast, which is like a big organization. So organizational support is really key. And I guess the other thing is how AI is going to interact with podcasts, because it can very, very easily pick up language that's written, but now as it gets better at audio, Is there going to be people, are they going to bother listening to the podcast, or will they just say, actually, I can't be bothered with all the jokes or the conversation. I'm just going to say, give me the key messages from this podcast.
Well, I mean, they'll have to right now, because every transcript that we've ever got from Descript and the thing that we used before it doesn't understand the Scottish accent, and therefore has been virtually unintelligible. Descript slightly better, but until it improves significantly, I'm afraid you're going to have to listen to our podcast at least if you want to get the message. That paper's the Lynn paper, isn't it, Callum? So that's looking at the past 10 or 15 years in emergency medicine and intensive care, because they've been real early adopters of podcasting and the FOAM, the free open access medical education movement. And I think when it comes to infectious disease and tropical medicine, we're just getting into our infancy, on it. We call ourselves the UK's premier infectious disease podcast. That's because there's only one of us. It's literally just us. There's another one that covers infection control, and that's it. Like that's the sum total of UK infection podcasting. And the other podcasts that we interact with, they're all American, or the Micromail podcast is from South Africa. And so there's just, at this point in time, just not a lot of us about. And so I think one thing that will happen is probably there'll be a bit more diversity as time goes on. There'll be more podcasts covering, this and that, and we won't be the only ID podcast coming out of the UK in a couple of years. Somebody else will listen to us and think we can do it better, and they're probably right.
No. You're the premier. You'll always be the premier.
Well, that's good to hear.
Yes. Would anyone like to add some concluding words to our discussion?
I think podcasts, probably peaked around COVID-19, and the popularity of some have fizzled, but they still remain quite popular. I saw that there were some podcasters who sold out, I think, the O2 Arena for a podcast, just for people to come and listen to them do what they already do on the podcast. And there's a trend, again, among the popular podcasts for these types of live events where the audience is interacting with them and they're recording them. And so I wonder if this is something that we also ought to consider for our global health infectious diseases podcast, is maybe considering doing live podcast recordings at conferences where folks can interact with us. The other thing I think is important to take into consideration is around funding and the monetization of podcasts. Many of you know how time-consuming and how resource-consuming podcasting is. And so we ought to really think about how do we generate enough resources, because I think with enough resources, you need that to sustain the podcast and to grow it, especially if the trend is more engaging live conversations with the guests and with that allows for video recordings for other platforms. Then we ought to think about how do we monetize the work that we're doing, whether it's getting grants or getting sponsorships or whatever it is. I think a lot of the more popular podcasts survive because they've been able to figure out the right content and being able to figure out how to monetize it. So this is something that we ought to really think about as a global health podcasting community.
Yeah. And Wealth, do you have any concluding remarks? Where do you see yourself in 5 years? At Wembley Arena?
Okay, so I think I have this, I call it fate, that there'll be a growing acceptance, continually growing acceptance of podcasts within the African continent over time. And I think something about Africa, sometimes we might come late, but when we grab hold of something, we become like the leaders, we practically take ownership of it. So podcast is still, particularly scientific or global health focused podcast, is still growing, and I think it's a pretty slow growth at the moment. But I think give us a couple of years, and then possibly Africa could be leading listeners to some of these podcasts that even from statistics that came from Global Health Matters and Infectious Diseases, Insight of Two Specialists. So we could be the leading listeners of some of these podcasts in the near future. And but I think just to echo what Desmond mentioned concerning funding, and I think I would like to see more funding for science communication, science education podcasts coming from within the continent. Because I think this was something that was mentioned during yesterday's session, that the whole issue of communication in the scientific context does not get support, monetary or financial support in the continent. And so I think that's something we really should be thinking about. How can we engage stakeholders and get the right people in to ensure that these platforms that are bringing so much value to the world and bringing so much value to the continent are sustained, and that they are, we are able to perpetuate their impact for the continent and for the world. And very importantly, that the funding is coming from organizations or institutions within the continent and not just from, external funders. Yeah, thanks.
Fantastic. Well, I love every session at the festival. We've done so many topics and had so many colleagues speak, but this has really been such an exciting session. You've inspired us a lot as kind of advocates for podcasts, and also you're the content of your podcast. So it's been an amazing session. Thank you so very much. I actually have loads of ideas. I hope I'll be able to email them to you before tonight. And the future is bright for podcasts, and really for putting the spotlight on all the amazing science, and behind that, the teams, the researchers, the labs that are moving this forward. So it's been a pleasure to meet you today. I'm sure the audience will join me in giving you a huge round of applause. We're all going to go download now like mad and support your work. And of course, we look forward to keeping in touch and seeing where these wonderful projects go. So I'm afraid there's never enough time, but we've covered a lot today. We're actually going to be moving on to our last session of the festival, which will be the film session, where we don't just watch films, but have a really good discussion around, like we just did for podcasts, around the role of film in neglected tropical diseases and more generally global health advocacy. So for now, just a really big thank you once more, and we look forward to keeping in touch. And until we meet again, all the best from us at ISNTD, and keep up the amazing work. Thank you for having joined us today.
Thanks very much, Marianne. Bye-bye.
Thank you very much. Thanks, everyone.
Keep in touch.
Thanks. Nice to meet you all.
Yeah.
Bye-bye.